Welcome to Gamble with Brandl. Today we have a patient that's found unconscious and he has a decreased respirations, constricted pupils, blood pressure is 110/70, heart rate 65 beats per minute. What is the best immediate treatment? So what does that look like? Found unconscious, decreased respirations, normal are between 12 and 20, so this is significantly decreased. So we are talking about respiratory depression. Pupils are constricted, so pinpoint pupils. Respiratory depression and altered mental status. This patient is unconscious. So this is a classic triad of an opioid overdose. So that fits very well. What do you do in an opioid overdose? You need to give a mu antagonist. And the treatment of choice is which? So we have here naloxone, naltrexone, methyl naltrexone, and flumazenil. So what are those? So naloxone is a mu antagonist, naltrexone also, methyl naltrexone also, and that's an antagonist at the benzoreceptor. So one of those three is the correct answer. The correct answer is actually naloxone. That's a first line treatment because it works very quick and we have it available in tons of different formulations. IM, IV, subcute, intranasal spray, so we have it available in many different ways, so we need to give immediately naloxone to this patient. Now I want to also explain the other choices. So what is naltrexone? Well, naltrexone is also a mu antagonist. It's available mainly orally, I think also IM, but it has a pretty slow onset and very long half-life. So it would not help us to immediate help this patient. It takes too long, and also obviously oral is not a good drug now to give to an unconscious patient. What do we use naltrexone for? Well, it's mainly used in opioid addicts or patients with alcohol use disorder to just block the euphoric effects of opioids or alcohol. So you're just going to block this mu receptor, and the next time the patient would drink something or would have alcohol, they would not feel as euphoric. So it's a drug that is used for substance use disorder, just to prevent further uses of the drug of desire. And then methyl naltrexone, what is that? That's also a mu antagonist, but it does not pass the blood-brain barrier. So it's a peripheral acting, peripheral mu antagonist. And what are we using methyl naltrexone for? We use it mainly for opioid-induced constipation. Because as we know, opioid leads to constipation, and the idea would be here that when we use, let's say, opioids in cancer-related pain or any other severe pain, constipation is always going to show up. So we want to have this mu receptors stimulated in the central nervous system, but we don't want to have them stimulated in the GI tract to mediate constipation. So we just block peripherally in the GI tract, that's peripheral, the mu receptor with methyl naltrexone. What is flumazenil? Flumazenil is a benzodiazepine receptor antagonist. So that's a good drug for an overdose with a benzodiazepine. Let's also look again and see how that is different from an overdose with an opioid, because benzos are also CNS depressants and also could get your heart rate definitively down, also your respirations down, but you would never have constricted pupils. So that's something, constricted pupils, pinpoint pupils, that's something very characteristic of an opioid overdose. So with benzos you would not have that. You could have unconsciousness, respiratory depression, particularly when you use benzos with alcohol together. But pinpoint pupils you would not have. And just as a quick review, are there any other intoxications that you could think about that gives you pinpoint pupils besides opioids? So I hear somebody saying, yes, there are. There's something that's called the 3 Ps, P for pinpoint pupils. This stands for painkiller, which is obviously opioids, phosphate, and pilocarpine. Okay, so phosphate comes from organophosphate poisoning, and organophosphate are cholinesterase inhibitors. So we're going to increase acetylcholine, and acetylcholine constrict the pupil. There's many other things also, because you're going to have salivation, lacrimation, defecation, urination, and all that stuff. And pilocarpine are eye drops, and I mean that's just because of the P. More likely would be something like an overdose with muscarine, which is found in certain mushrooms, but that's the same, it's just a muscarinic agonist, and muscarine obviously as well. And so you're going to stimulate the pupillary constrictor muscle on the eye, on the M3 receptor, and you're going to get pupillary constriction. So these are all drugs that would lead to pinpoint pupil, but with these muscarinic ones, you would, for example, not get bradycardia, but you'd rather get tachycardia. Okay, so this patient needs naloxone.